Hi, welcome to Your Health, Your Choice, a series focusing on health, education, and medical choice. I'm your host, Dr. David Berger. Today we are going to be talking about why some families choose a holistic approach to their children's health care. We will be joined today by my first holistic pediatric patient, as well as her mother and her daughter. Please subscribe to our YouTube channel, as well as join us on our social media platforms. Today, I am so excited to talk to Jacquelyn Davis, Isabella Cardosa, and Violet Cardosa. Jacquelyn was the first holistic mom to bring a child to see me for holistic pediatric care back in 1996 when I was a resident at Tampa General Hospital. And now Bella brings Violet to see me, making Violet my first second-generation holistic pediatric patient. So hi guys, thank you so much for joining us today. So first I wanted to talk a little bit about how we first connected way back in the mid-90s. Jacquelyn and I were both frequent visitors at Skipper Smokehouse, which is Tampa's premier live music venue, where we would get together with a bunch of our friends every week. It was Grateful Dead night, and we would all hang out. And then one day, when I was in my pediatric clinic, somebody appeared. So, Jacquelyn, maybe you can share with us a little bit as to how it kind of came to be that you came into the practice.
Well, as you said, it was way back in '96, and we had some local hangouts where I would see a familiar face time and time again, and was pleasantly surprised when we went to a checkup, and we saw Dr. David. Very pleased to know that there was someone there that I felt comfortable with, that I could trust.
That's really great. Now, tell us. I know that you have some medical background from a healthcare employment perspective. Can you share with us a little bit about what your background is?
Well, when I first became pregnant with Isabella, I had no training at all, and it was through my pregnancy, through a job that I started making herbal extracts for Herbs of Light, and I was learning. That was my first education on homeopathy or holistic medicine, or, just a different way than taking a pill. And I was very fortunate to work there while I was pregnant. And that was how the door opened for me. And then, medically speaking, after I had Isabella, I became good friends with the midwifery I became very good friends with the ladies at the midwifery that delivered her. And I was a single parent looking for a job. And I was very fortunate that Mary O'Mara took me under her wing and trained me. She and Suzette, wonderful people over there. Mm-hmm. Still very good friends with them.
Me too.
Yeah. And for those who don't know, Mary O'Mara is the head midwife at Tampa General Hospital, which was really one of the first hospitals that had a full midwifery center associated with the hospital. And now there are others, but they were really some groundbreakers back in the day. And it was wonderful to have them as part of the team, and knowing that there were people who were able to get other health options for their birth and for their prenatal care. And they're still a great group over there. And it's such a wonderful thing to have them in our community.
Yes, they definitely have made a difference.
Yep, they took care of me when I had Violet as well.
So you brought Bella to Tampa General Hospital, which is where I was a resident. Tell me a little bit about what your experiences were prior to seeing me with the other pediatricians, and then also how it was once we connected on a medical level and saw the type of care that I was wishing to provide.
I didn't feel as though, I guess it's a bedside manner thing, maybe. I did have concerns before we met, or before she came to see you, about a difference of opinion on what is best, and if the natural way,
or even what is okay,
or even what is
okay, accepted.
There wasn't a lot of information on using herbal extracts with children or with adults at all. There wasn't a lot of information when I had the breastfeeding issues that I had. It was hard to find good holistic or natural remedies, like for something called thrush, which is a yeast. And nobody said anything about the Candida diet. Nobody said, hey, you need to go on this diet for 2 weeks. because you have a systemic candida infection. No, they just wanted to give me a pill, and the pill wasn't working, and things were getting worse. And so I felt as though I wasn't being offered all of the options available to me. And maybe the people that I was looking to didn't know about homeopathic or, natural medicine. So I was very
Right.
fortunate that when I saw you and was able to bring her in to see you, that I knew that you would be not only interested in other ways, natural ways, but that you were probably going to give me some information that I really, really wanted.
Yeah, I hear you. And one of the first things and I remember so clearly that Jacquelyn had said that to me, and she was a little hesitant to say it at first, not knowing exactly how I would respond. But one of the first things I remembered was that she explained to me how she would use breast milk when for eye discharge, like pink eye type of thing, which to me made perfect sense. It had antibodies that's in breast milk, and so that's a great way of treating an infection with antibodies, so fight an infection. And the neat thing is that I knew that at that point I had already known that within 4 hours of a mother being exposed to an infection, she was already putting the antibodies into her breast milk. So it was almost like your own individualized natural antibiotic that was right then and there. And then I started learning about how I could use it for eczema. And I kind of then started realizing that I could use breast milk the way that most guys or most people use duct tape. And I would find all different types of applications for it. And that was really pretty spectacular. I was fortunate in that the founder of the Tampa General Pediatrics USF program, Dr. Lou Barnes, who was really the godfather of nutritional and B vitamin based approaches to healthcare. And so when he came to start Tampa General program, he became one of my mentors, and he would come into clinic all the time and give us information about why this medication was bad, why people are using antibiotics over and over, and doing things that would really open my mind up. And during that time period, and this was also right around the time where I had met Bella, there was an article called 7 Herbs That Every Pediatrician Should Know About. And it was in Contemporary Pediatrics, which was our Academy Pediatrics trade journal, which happened to have also been started by Dr. Lou Barnes, who was still one of the editor emerituses of the journal. And so when I then asked if it would be okay if I were to use these treatments in our clinic, right off the bat, the department said to me, hey, if it's in Contemporary Pediatrics, it's completely fair game for us because that's our home journal. And so that's what really gave me that initial comfort level of looking outside the box, maybe keeping one foot in the box and one foot outside of the box. But it really gave me that strength, which was so important for me as an early young physician.
Yeah, I remember telling you what I had been doing for the pink eye, and I remember I was scared. You were so excited. I remember you had your the chart and your pen, and you said, well, it looks like it's getting over pink eye, because it was, I think, a Monday when I came in. So over the weekend I had been squirting her in the eye with breast milk. So you said, well, she looks like she might be might be resolving. What have you been doing? And I said, squirting her in the eye with breast milk. I was so scared to say it out loud that people were going to think I was crazy. You know what I mean? But you were like, and how many times a day have you been doing this? And for how many days? And you were so excited. And I was so elated. Relieved that I didn't have to worry that, somebody was going to think I was just some crazy lady, So yes, it was definitely a comfort to know that I was going to be seen as a parent, just taking care of the kid.
Bella, so I left Tampa when you were approximately 2 years old, and then moved back when you were about 9 years old. And I know that we had seen each other from time to time, but I was wondering if you could share a little bit about what it was like when we would see each other and how it was when I was back in town and also seeing you as a pediatric patient.
Well, we've definitely known each other for my whole life. So it's been a while, but I do remember you guys coming back to town and initially getting like my first reaction with you guys. And of course, like the big smile, the tie-dye shirt, that all that jazz or whatever. And then my first actual reaction seeing Dr. David, and getting my physical for cheerleading and kind of just like feeling comfortable, you don't get like that doctor scare, I kind of felt like it was cool to see you in that aspect because it was super different, but I wasn't like nervous. You know what I mean? I kind of just felt like I was like at your house or something, you know, so it wasn't really like a scary thing. Also, I remember actually babysitting your kids and coming to your house and being like, oh, this is cool. I get to be in Dr. David's house, and like knowing you from being a kid. And like, I don't know, I like how I definitely got like the personal aspect of you, but I still felt like the professionalism, even as a kid. But also being a mom now and being, you know, somebody that has a daughter that is a patient of yours, I kind of feel exactly how my mom probably did, you know, just the comfort of knowing that, you know, I can take my daughter to you guys, and you guys, if I was a medical doctor and had all the information in my head that you guys do, you guys treat her like I probably would, you know, and that's why I feel very comfortable with you guys. Honestly.
So in terms of some of the actual healthcare approaches that I have brought with you, which maybe you can share a little bit about what you remember and what you've observed with just some of the general types of treatments and the approaches that I've taken, perhaps how it would have been relative to other doctors.
I personally feel like the only time I really had an experience with other doctors was whenever I was actually having Violet. But I do feel like I was very pressured in a sense, and not really pressured to do anything that I might not have wanted to do, just very pressured. Like, this is the way we do things, this is the way it works, and there's kind of like no wiggle room. And I kind of felt like whenever I was, you know, before I left the hospital with Violet, they were like, well, you need to do things like this, you need to do things like this. And I didn't really know what to do because I was a first time parent, and you know, I have things that I want to do in a lot of ways that I like feel like I should do things, but I don't know because I don't have any letters behind my name. So you want to listen, but I felt uncomfortable with a lot of the things that maybe they wanted me to do, or like, you know, the rules that they had and such. So I kind of just didn't know. But I definitely feel different with you guys because I feel like there are options, and I feel like not only do you guys not like go by one set of thinking, but it's very like open. You guys want your patients and your patients' parents to know what's going on and to learn about what their child is going to be doing or what they're going to be taking or whatever in terms, and why, in terms of like education. In terms of educating our parents and everybody really in terms of like holistic medicine.
Yeah, that's great. And you know, you mentioned the word need, and when doctors use the word need, that's actually overwhelmingly when I hear patients have told me that their doctor used that word, and I've kind of been taken aback by that because to me, when the doctor says the word need, that kind of cuts off the possibility of choice. And so to me, we need certain things. We need love. We need health. I mean, we need food. We need shelter. We need clothing. We need water. Everything after that is kind of optional in
Right.
how we wish to approach things. And so I just get really bothered when I hear that, because when a professional tells you you need this, as opposed to saying, I suggest this,
Right.
you know, I think it would be a good idea for you to look into this further. Even if they were to say, I think you're an idiot if you don't do this, at least they're expressing that as an opinion to you and letting you know that it's an opinion of theirs and not that it's something of sacred ground that you have to do this or you are a bad mom. And
Definitely.
so I'm glad that you mentioned that, because that's been a word that I have, like the plague,
Yeah,
avoided throughout my career because it just kind of
I
doesn't fit
agree.
with my philosophy of this. Yeah, absolutely.
I I was always a little upset by the, like, it's almost like you were insulting docs if you didn't just go
right.
right with whatever they said, like you were,
Hmm.
you know, somehow personally insulting them, you know. And with you guys, I felt like this was a team of people coming together with the information at hand and giving us all of the information that we need. If A, then B, risks, benefits, contraindications, those types of things, what to
I
look for,
agree.
what not to look for. You know,
Well,
I
it comes with education. You guys, you come with education. You're not just doctors that want to listen to me. This is the reason. Here it is. And you can take it or leave it. You guys come with education. You're like, well, what do you want to talk about? What do you have questions about? I can help you and lead you or guide you in, you know, the path of whatever you want, whatever kind of care you want for your child. I feel like that's probably most important.
I really appreciate what you said regarding when you talked about team, because that's really very much the foundation of what my approach is to healthcare. Not just the team of individuals and my staff that we've built around us, but also that the parents are an incredibly important part of this team. And parents will have a different perspective than the physician will, or the provider will. And it's super important for us to hear each other because we all have different skill sets that will come to the table. And so whenever I have the opportunity, and I recognize that, maternal instincts are great, but I also realize as a dad myself, I have same-sex couples who come in with two moms, two dads. And, the great thing is that even like my families who are adopted a child, that the instincts that a parent will almost instantaneously have, because that bond, it's almost like that imprinting has taken place with the child, that it really just sets a wonderful aspect of the team. And really one of the most important things that I constantly want to bring back to that, because again, it takes a village, it takes a team, and we're not, and any of us individually, the sum of the parts, we know that the totality of it all is what brings the best outcome. So I really appreciate that you brought that up.
I always felt like you guys were advocates for parents taking a more forward approach instead of going to the doctor traditionally and having them tell you, as the parent. I felt like you guys were advocates on me coming in and questioning, hey, I know this is what people normally do, but what about this? You guys loved that. You guys wanted that. You encouraged that. And that made me feel, it raised my self-esteem as a parent, because I was wondering, am I doing this right?
Absolutely. And overwhelmingly, parents do things right. And sometimes they just need the support of a professional to say, hey, you're doing it right. Hey, there's more than one right way of doing these things as well. If you're not doing it right, I'm not shy, and I will kindly and in a supportive way explain how things can be done better. But nonetheless, I still really want to default back to the parent. And there's so many topics and things that we will be getting into in future episodes, talking about prolonged breastfeeding and my approaches to being doing lactational consult work myself, which is not something that most pediatricians, let alone most guy pediatricians, do. But to me, my staff knows that this is the absolute most important thing. When a woman calls up saying, hey, I'm having problems nursing my child, my staff knows that that goes to the top of the priority list. We will not allow that to go on any longer than possible, bringing them in to see. And that's just so important. But, other topics, when we talk about vaccines, and when we talk about taking for this particular treatment, do we go medicinal versus do we go in a more herbal, natural perspective? That still all comes back to what a parent's comfort level is for their child, because as we say, it's your body, it's your choice, it's your child, it's your choice. And just like I have families who say, hey, I'm not quite there yet in starting my child with a vaccine. Can you help guide me through that? And I have other families who wish to follow the CDC recommended schedule. And from my perspective, again, it comes back to your body, your choice, your child, your choice. And so I'm looking forward to also in future episodes getting into other topics that we'll be able to explore future with our family out there in the internet world.
Awesome.
So it has now been 25 years since I have been providing healthcare to your family. And to know that all three of you being patients of mine and having these types of health discussions for all of this year. So I was wondering how it is for just you guys in general of being that multi-generational family working.
You want to start, Mom?
Okay. Well, it's a relief for me knowing that if she has a question, she can send you a message or a picture of a rash through the patient portal. And I know I don't have to worry because you guys know what's up and I trust you implicitly. So as a grandmother, I know that I can sleep much better at night knowing, oh, well, I don't know what that is, Isabella. You need to take a picture and send it through the patient portal.
Yeah, I can't tell you how many times I've called her because of her small, be it small or not, medical background. And she's been like, well, you know what? I think it's this, but you should probably just call Dr. David. And I'm like, okay, fine.
I'm always happy, of course, when it correlates with what I thought. I'm
Right.
like, yes.
Yeah, they're definitely always available at the patient portal. That's definitely why I love you guys so much.
Great thing for the patients to be able to communicate with them.
And who knows, maybe before I retire, 20, 25 years from now, maybe I'll be taking care of your great granddaughter.
Well,
No,
if you're
that's
still in
true.
practice, you sure will be.
Yeah, that's for sure.
Guaranteed.
I agree.
So I want to just say, how blessed I feel that we've been together for so long, and the appreciation that you have of what we're able to do. I know that you've sent many people through the years to see us, to get the type of healthcare that you've received and want to receive. So just thank you so much for being part of our practice, being part of my life personally. And it's just such a wonderful, joyous thing to be able to share with you, and to, of course, share this little beautiful girl in front of us. So Violet, it was so nice to see you. Can you give me a goodbye? Can you give me a good wave goodbye?
Dr. Dave.
Yeah, all right. Well, it's so nice to see you. Bella, Jacquelyn, thank you so much for joining us, and I look forward to seeing you live
Thank you
again
so
soon.
much.
Thank you.
You're very welcome. I love you. I'll see you soon, okay?
Thank you,
Love to
Dr.
see you.
David.
Bye.
Thank you, everybody, for joining us today for this episode. It has been just an amazing experience to be able to take care of 3 generations of people, and to know that you can have that type of connection with somebody as a healthcare provider. To watch my baby become a mom, and to watch another baby now growing. And it's such an amazing experience, and there's very few opportunities in life that I think a person from a professional perspective can have that. And so, I count all my blessings when I'm able to have these types of impacts, to going to the wedding of one of my previous young children patients, and just to see that in those lifestyle events. And that's really what this is all about, to make that type of connection with people, to be able to hear what they have to say, to be able to help incorporate that into the plan that we're going to put together. And so thank you very much for joining us. Again, please join us on our social media platforms. Please subscribe to our YouTube channel, and I look forward to talking to you again. Bye-bye.